spring season, as you know, but the flu season is sticking around in our region far longer than I think many of us anticipated.
For sure. And hospitals are seeing a big uptick in flu patients. Health officials also say the flu is hitting us later and in some cases harder. With the weather as it's been, the last thing you want to do is remain at home sick from the flu. But throughout the region and the state, the flu is doing a number on our immune systems this year.
We've had a double whammy this season of almost, you could think of it as two influenza seasons packed into one with two different influenza A strains circulating.
Jeff Dushin of King County Health says this double whammy hit the season first in the fall and Thanksgiving timeframe.
And then late winter, we had a second wave with an influenza A H3N2. And this one is the A virus that's associated with higher hospitalization rates and death rates, particularly for older adults.
Thankfully, he says the numbers of deaths have not grown as much as the number of illnesses. Still, though, 139 deaths have been linked to influenza so far in Washington this flu season, which dates back to late last year. It's prompted the state to say flu activity is elevated right now.
Two influenza A viruses circulating at high levels in one season is very unusual. It's the first time I recall seeing that.
Health officials say right now kids are the latest uptick in flu cases. Up in Snohomish County, they're seeing more schools report more than 10% absenteeism because of the flu.
The week ending March 23rd, there were over 31 total schools that have reported that. That's more than double what we've had in previous years.
Not only that, hospitals are being inundated with patients. Medical officials say the best defense is the flu shot. King County Health says this year's vaccine is 47% effective, meaning the chances of you getting the flu decreases by almost half. And while the flu is a bit later than usual and maybe hitting like a ton of bricks right now for some, there is a bit of hope.
Flu will be declining and with us for another 4 to 6 weeks on the downturn.
Here is some advice, though, from King County Health on when you should see a health care provider. They say when you have a fever that is 100.4 degrees, that's lasted for more than 4 days, when flu symptoms improve but then return with another fever or cough, you have fainting spells, dizziness, or severe dry mouth, pregnant women should seek immediate care, and people younger than 5 or older than 65 who have flu symptoms should see a health care provider too. Another step Snohomish County health officials tell us is if you have flu symptoms, they tell us to not cook for others. They say that is often an overlooked step in preventing the flu.
Well,